So welcome back. Today we are going to discuss about coronary circulation, the blood supply of heart. Understanding this is crucial because coronary blockages are one of the major cause of myocardial infarction. So empathize, as we all know, sometimes the patient will be saying that I feel a heavy chest or heaviness in my chest while I walk or while I do some strenuous activities. So coming to the ideate, it is nothing but we need to visualize the heart blood supply, identify the areas in which the coronary blocks is being present, and we'll be understanding and correlating between the anatomy and ECG findings. So coming to the topic, so what is coronary circulation? It refers to the network of arteries and veins that nourishes the myocardium. So the coronary arteries arise from the ascending aorta just above the aortic wall. These vessels ensure constant oxygen delivery to the heart muscle. So what are the main arteries? Coming into the anatomy overview, so let's break down the major arteries. So left coronary artery, that is LCA in short. So it divides into two key branches. So for the first one is left anterior descending, that is LAD, as we all know, supplies anterior wall and septum. So whereas the second one is left circumflex, that is LCX, supplies the lateral wall. Whereas on the other hand, the right coronary artery, that is RCA, it supplies the right atrium and right ventricle, and it also supplies the SA node and AV node in many individuals. So blockages in these vessels produce specific MI patterns, that is myocardial infarction patterns. So coming to the venous drainage, so the deoxygenated blood returns through great cardiac vein, middle cardiac vein, small cardiac vein. So all draining into the coronary sinuses, which empties the right atrium, coming to the clinical importance. So clinical importance is nothing but coronary artery occlusion leads to ischemia and myocardial infarction. So some classic association is nothing but in case if RCA is occluded, there might be inferior MI, that is inferior wall myocardial infarction, and bradycardia as well. Whereas if the occlusion is in LAD, that is left anterior descending artery, the anterior wall MI might be present. Whereas if the occlusion is in LCX, the lateral wall ischemia might be present. So the blood flow in the coronary arteries occurs maximally during diastole, not systole. So that's why tachycardia reduces the coronary perfusion. So the flow chart is nothing but to summarize the pathway. Let me tell you in short, it is nothing but initially aorta. From there it goes to left and right coronary arteries. So furtherly, their branches supply the entire heart. So the venous drainage via the coronary sinus is happening, in which it is further directed into the right atrium. A clean understanding of these loops helps doctor to interpret ECG changes and identify the area of infarction. So now the interesting part is the MCQs. So the left coronary artery mainly supplies. So I repeat the question once again. The left coronary artery mainly supplies. So the options are left ventricular apex, the SA node and AV node. The third one is the option C is interventricular septum. The fourth one is left atrium. So as we all know, obviously the answer is B, that is SA node and AV node. The second question is the coronary arteries arise from pulmonary artery, left atrium, ascending aorta, descending aorta. So the answer is ascending aorta. As we all know, ascending aorta, the coronary arteries arise from the ascending aorta. Since the name implies ascending is nothing but that is starting from less to greater. So thereby the coronary artery starts. The next question is the left coronary artery divides into option A RCA and PDA, option B LAD and circumflex artery, option C SA nodal artery and AV nodal artery. Option D is nothing but marginal and diagonal arteries. So as we all know, the answer is option B LAD and circumflex artery. So the last question is blood flow through coronary arteries occurs mainly during option A ventricular systole, option B ventricular diastole, option C atrial systole, option D isovolumetric contraction. So as we all know, the right answer is option B ventricular diastole. So that is all about the coronary circulation in nutshell. Simple, structured and clinically useful. If you enjoyed learning, Thank you very much.